Alrighty. So this is the next type of topic that we're going to jump into, called payment types. There's a payment types called capitation. Remember, all of these topics, guys, you need to know. So capitation, this is a payment arrangement for a healthcare services provider, and it pays out a set amount of money each person is assigned to them. So say, for example, you are a doctor, right? And you, myself, is your patient. The government give you $200, $500 for us each month. Now that $500 for each of us, you have to use it for our medications, our blood work, for the service that you give. You have to do everything with that $500 for us as it relates to healthcare. That is what capitation is. So if you, like a budget, someone give you $500 for the house, and you have to make sure that it takes care of the lights, the children, the water, internet, everything. That's capitation. CT scan, MRI, blood work, CPT and OT. You're not going to have any money for your services. So the best care that you take of the patient, and it's not that you're going to limit the amount of labs that you order, but you want to make sure that you're taking best care for patients, so that you don't have to order so many things and you won't get money for your services. All right, let's look at this example. A primary care physician might receive $250 per month for each patient enrolled in their practice. This $250 must cover all necessary care that the patient include office visit, preventative service, management of chronic disease. It's just as I explained, that you must, capitation is a set amount for each patient that covers their healthcare services. If you use all of that money to draw their blood, to do other diagnostic tests, you will not get any money for your services in the clinic. The doctor will not. So that's capitation. Now let's look at Medicare. I know this is a lot of information, and that's why I'm giving you guys a recording, so that you guys can go over it and over it. So there's part A, B, C, D. Here's how I remember this. A is inpatient stay. And I know all of you guys are ambulatory, but I remember it by saying this. People in the hospital, the nurses in the hospital, behave as if they are the creme de la creme, because they're in an acute care setting. So they behave as if they're A+. That's the nurses in the hospital. So part A is hospital. Part B is clinic. They think we are the second-class nurses because we work in the clinic. So they think we are B class. So hospital think they're A, and they think we're B. Hospital covers inpatient, and part B covers outpatient. C is part A and B together, as well as it may have some extra benefits. And D stands for drug, covers the medication. All right? Any question about that? You must know the difference between part A, B, C, and D. A patient called the clinic and said that, well, they only have part A. What can be covered with this? Oh, these are for hospital visit, including long-term care hospital. Part B, what can I do? Part C, part D, what do you need? What kind of Medicare insurance you need for them to fill your prescription? That is part D. All right. Another type of insurance is what we call the Tricare. So Tricare is a healthcare program of the United States Department for the Military Healthcare System. And this covers active military individuals who are retired, their family, it doesn't matter where around the world they are, Tricare provides comprehensive coverage for all the beneficiaries. When you hear Tricare, think the United States Department of Defense Military Health System. It covers the active duty, individuals who are retired, and also their families. All right.